My name is Martin Bell. I'm a board-certified plastic surgeon, and I've been in practice for 30 years. One of my specialties is rhinoplasty, and that's what we're going to talk about today. Rhinoplasty is perhaps the hardest operation to learn and to do of all the cosmetic surgery procedures. I've been in practice for 30 years, and I've done at least 1,000 of them, and I'm still learning from something from every one that I do. To try to help you understand rhinoplasty, I'm going to show you some diagrams. This is a picture looking through the skin of the nose into what is underneath the skin, and basically what we have is two cartilages in the tip of the nose that are called the alar cartilages, and then two cartilages above the tip that are called the upper lateral cartilages, and two bones. And basically what rhinoplasty consists of is modifying some or all of these cartilages in order to give a different shape to the nose. We can get at these cartilages from the inside of the nostrils, or sometimes, particularly if we want to make major modifications of the tip, we'll make a little incision under here and lift the tip of the nose up so we can actually directly see these cartilages. And if you look at a side view, what a lot of people present with is a big tip and a hump on the back of the nose. So what we do is we go up inside, we remove a portion of the tip cartilage, and then we remove a portion of the hump, and that makes the tip smaller, and it makes it rise up, and it removes the hump and gives a smooth back of the nose. When we do that, we have to do another step, because when we remove the excess from the upper part of the nose, it may look fine on the profile, but it's too wide on the front view. And so again, through the nostrils, we introduce an instrument that makes a chisel line along here, and we make some little incisions in the skin up here to go across the top. And that's what people often call fracturing the nose. And after we do that, we're able to squeeze the nose and make it narrow. And then finally, if a patient has wide nostrils, we can take a wedge of tissue out of the base of each nostril and move the base of the nose in to make it narrower, and here are the little stitches that we leave from this. This incidentally shows the incision in the tip of the nose if we want to open the nose, and we do some noses that way. Now, not all rhinoplasties are cosmetic or purely cosmetic in nature. Sometimes people have breathing difficulty through one or both sides of the nose, and that's especially true if they've previously broken the nose. So in addition to the things I've already shown you, we sometimes do what's called a septum procedure, a septoplasty, or a submucous resection of the septum, and that is also done from the inside. The lining of the nose is raised up, and the deviated part of the septum is removed or modified so as to open up the airway. This is one of the pictures we looked at before, and this partition down the middle of the nose is what we call the septum. And when it's crooked or broken, it can lean off to one side or the other and cause breathing difficulty. So the process of septum resection or septoplasty, involves straightening this part of the nose to make breathing easier.